This is a collaborative partnership with Zuellig Family Foundation, the Challenge Initiative Philippines. It is a demonstration of a successful adolescent pregnancy reduction and family development strengthening in the city of Baguio. Baguio is home to 384,000 people, and it has a very volatile and very mobile population, where it is a center of tourism, education, and commerce. And so a challenge on that is we have different populations coming in and out of Baguio City. But still, we would like to prioritize women in reproductive age accessing health services and making available our health services to them. Also, there is a need that our adolescents be prevented from getting pregnant for first, second pregnancies among our adolescent parents, and to provide social welfare for all adolescent parents and ensure education for all of them, and to convert all health district facilities as adolescent friendly. What is being seen is that there is high adolescent pregnancy in the city of Baguio. There are few women getting free and efficient services on family planning. And perhaps we have data mismanagement, and that what is not seen are that few of our health workers are not trained on adolescent related courses. There are weak social behavioral change communication, few health professional trained on our family planning, and most of health facilities are not adolescent friendly. And there is no enough policies to support our adolescent youth and sexual reproductive health, lack of trainings for healthcare workers, and poor health leadership. And so we found that really there is an extreme sense of urgency to attend to the needs of all these health workers and to be able to effectively give the health services to our adolescents. Have all our healthcare workers undergo necessary training and enact policies to support all this all these programs on adolescent development, and of course, a budget allocation. Before the TCI came in 2021, the modern contraceptive rate from 2019 to 2020, we had 21%. The adolescent birth rate from 25% to 24%. So what were the strategies that we have initiated with the TCI? Systems were in place, a lot of meetings, mentoring, coaching among all our population workers and other healthcare workers in the health centers. There were a lot of the city leadership training meetings, and there was resource mobilization, policies, and of course, quarterly implementation assessment. So what were the target outcomes? In 2022 and 2023, we have passed two policies for adolescent health development. And we would like to commend our former counselors with us right now, Mr. Levi Lloyd Orcales, who is now a barangay captain and coming back next year in the Sangguniang Panlunsod to again help us make policies on our health systems improvement. We also had the ordinance on teenage pregnancy prevention. The most important thing that we realized that in 2022, we only had 209,000. But in 2024, with all the collaboration that were made, the local government commitment total to 20.5 million for our adolescent development. Even for our self-reliance score at 100% in 2024 from the 62% in 2022. There's a high level of capacity in the city of Baguio. The local government has well-developed and well-functioning credible systems, adequate resources, and viable family planning programs, All domains were successful, except for capacity, knowledge, and skills transfer because of the um, absence of some of our health workers to attend the trainings and the fast turnover of our staff. So we just had to continuously have capacity building among them. So all the domains were 100% except domain number 2. So the access indicators have really been achieved, okay? For our community health workers, 100%. For our health centers, that uh, that 14 out of the 16 are now primary care facilities and accredited e-consulta providers. 100% were able to give postpartum family planning services and adolescent-friendly health services. Mobile outreach services were around the city of Baguio in strategic places. 9,600 clients were served, and community group engagements were increased because of our partnership with TCI. In 2021, we had level 3, 5 health centers, and the rest of our uh, 11 health centers were level 1. But after that, after our partnership with TCI, 11 level 1 health centers became level 2. Our level 3, we were assisted by TCI to be maintained at their level 3. For the fund utilization, we have 83% this quarter of the year that we have liquidated of the amount of from the amount of 20 million. So we are doing our best to be able to accomplish and to liquidate all these funds for our adolescent development. The modern contraceptive prevalence rate, as we know, the standard is 30% of women of reproductive health, of reproductive age. And in 2024, as of August, 31% of our adolescents, of women with reproductive age are into modern contraception. And among this 31%, we have observed from 2021 to 2022 to 2023, there was increased number of adolescents being current users of our modern contraception. For the adolescent birth rate, from 2021, from the time we had initiated this adolescent development programs with the TCI, we have put down our adolescent birth rate from 24 to 12.8% as of August 2024. So what are the lessons learned? We own the problem and we take accountability from this. And this fuel us to move closer with our stakeholders, to move closer with them to be able to attain these indicators and these outputs. If we have near real-time quality data, which we are now focusing, then perhaps really we will be able to have successful decision making with our stakeholders. Our active parental and family involvement fosters open communication and support for adolescents regarding sexual and reproductive health with the basics of education starting at home. Increasing access to contraception and actively involving the private sector in service delivery is essential. For co-creation, a youth and adolescent-led program promotes inclusivity and acceptance, balancing demand and supply by ensuring that facilities and service providers are adolescent-friendly and welcoming is crucial. With this, I'd like to extend my deep appreciation to our partners in the city of Baguio, our director of the Commission on Population and Development, Cecil Basawil, is here. Thank you so much, and all of our hospital members of the city leadership training, our partners in the barangays. Thank you very much, Cap Ariel, and the rest of the group. Maraming salamat po.